So questions that people have for us today. Yes, Marissa. So the question was, where does acupuncture come into the management of myofascial pain and pain in general? Is that in trigger points? So I have the guru who wrote the Cochrane review on acupuncture. Andrea, do you want to speak to acupuncture and myofascial pain?
I am an acupuncturist. I did. So I am a firm believer that acupuncture works. I am the author of the Cochrane Review of Acupuncture for Low Back Pain, which is desperately for update. I just don't have time to update it. But it works. And it works wonders. It's just that it's not covered by the government. So guess what the government covers? Opioids. Yeah. So that's a big, that's a big problem because it's expensive.
Yes, question here.
What you guys are doing in recognizing... Sorry, I'll stand up and speak to the room. What you're doing in recognizing the causes of pain and the locations of pain and how to treat pain is just fantastic, and I commend you. I'm sure everybody in the room does. But I've got a question about a patient today. What does a patient who is suffering from chronic pain, who has been prescribed opioids, I mean, the progress you're making is great, but I'm afraid that, and I know someone in this situation, I'm afraid that this person's physician isn't aware of the progress you've made, or isn't aware that he or she shouldn't keep just writing prescriptions to this poor patient who isn't getting any better. And yet, I'm more worried about this patient's dependence on opioids than I am about the chronic pain. So what should this person do today?
So great question. That's the problem that we face, and we've got incredible wait lists to get in to see us. So that's where the ECHO project, and that was the reason why Sanjeev Arora down in New Mexico said, I've got drugs that can help hepatitis C get better and cure people instead of dying. But I can't get that knowledge out to everybody. So the ECHO is one of those things. So having that family physician for that patient come and participate this Thursday for 2 hours, I get mac and cheese. I get my mac and cheese Thursday, and I sit there and we facilitate family physicians, nurse practitioners on how to manage that patient right there. They finish at 2:30. They can have them booked for 3 o'clock and see them right then and there. So we're now educating many other sites to do the same thing. So I tell 2 friends, they tell 2 friends, and so on, just like in the commercial. That gives us an opportunity to raise the bar for all of the physicians and nurse practitioner and pharmacists that are managing this. This kind of information wasn't known. I never did a urine drug screen until she taunted me into doing urine drug screens. How did I know the patient was actually using the medication or diverting it to the street? I had no idea. Urine drug screens are my favorite time now because I get information that is fascinating. I had one of my patients in her 60s, positive for cocaine. Fascinating conversation, non-judgmental conversation, because she wasn't using it on a daily basis, but it was recreational, and that could have led to some really bad stuff as a grandmother dying of cocaine, right? That's what the headlines would have said, because papers love headlines. But the point being, they don't know the risk, right? And so that's one of the things that's around education. So that's one of the things we can do right now is get that family doctor to sign up on this Thursday to participate. So great question. So so people heard that. Where's the affordability and how are we actually going to manage this stuff? So our program here, the CIPP, the complex integrated pain program that Dr. Malis and I collaborated with over Toronto Western, and she's now up practicing in the community because she's never going to quit, even though she's been in the field for 35 years doing this stuff. We integrated that program and I brought it over here. So now we have treatment funded by the government to do self-management programs, to do mindfulness-based programs, to do I Chi in our pool, which is right next door, to do land-based programs as well. But we can't fish for everybody. We need to teach them how to fish, because they have to manage themselves. So the 5 things I talked about: get a good night's sleep. We have to manage their sleep with non-habit forming medications. We have to get them to do the exercise. It's not me doing the exercise. They don't have to become athletes. They don't have to win gold medals, but they need to do 30 minutes of exercise. We do that through education. Move the joint, make the muscles strong, and then stop smoking. Those 5 simple things work on every single patient that has chronic pain. So that would be one of the things that we can do right now. And we're investing, we're trying to do the research around this. We do not get money from the government to do the research. We get money to do the treatment. We need your help to get the money for us to win the grants. Only 7 to 10% of applications to CIHR get funded. She kills herself putting this research projects together only to have one person who reviews it and say, I didn't really like that. And so you get one reviewer that doesn't get you the funding on this stuff. So it's very competitive. So we need help on how to do the research.
I'll explain my quandary and ask how you can help. Is this on? Yeah. So I have a client who was badly hurt in a head-on car crash. She was leaving her home, which was in a rural area near Peterborough, going up the crest of her hill. At the same time, her husband was coming home from work, going up the other crest of the hill. He leans over to pick something up and goes into her lane of travel, hits her head on at 80 kilometers an hour. I don't think it was intentional. She suffers very significant and complicated fractures. She had an 88% whole person impairment rating on a catastrophic scale, plus she's got a mild traumatic brain injury. That was 5 years ago, and she's been on opioids ever since. Nobody's picked up on it. I'm not being the saint, but I'm in tune with the opioid crisis. I've participated in and sponsored and put on 5 conferences around the province on medical marijuana. And we had a pain and addiction research specialist on our panel, and he comes with us to each of these. I would think she'd be a perfect person for this ECHO program, but those that are in charge of her health care are the perpetrators. They're not going to set up any kind of ECHO program. I'm not a healthcare professional, so I can't, I gather, get on board and participate with her. Is there a program under these circumstances that I can say, I'm going to refer you to Dr. Furlan or Dr. Flannery or to some program here where she can get the help? Because I want this lady to get off opioids.
So, great question. Thank you, Jim. So, I'll just sort of move over here. So, not have my back to anybody. That's one of the tragedies that we have in our society. And that story is echoed. I mean, you don't create a program like we have here quickly. I remember, I didn't say that I did chronic pain for a very, very long time because I didn't want to get eaten up in this system. And you can, because we're compassionate, caring. We'll do the extra little bit because we love the outcomes that we get. Now, if I can get someone back like Kirk, back off the opioids and functional, the goal is to make them taxpayers or volunteers. You got to be back to doing taxpayer or volunteering. So this is someone who's now impaired because we've got a system that is systematically driving her to stay on the opioids. And she likes them, right? Emotionally, she kind of likes them because that's the problem with these different receptors. They give the happy center a lot of reward. And so people get reward from these medications. So we really have to work hard on that. So we've created a team that can do this, can slog through and make these kind of changes, because if she doesn't want to change, we're never going to get better. So that's the first thing. She has to want to. And if we're not at that point, and we're actually assessing her, so if she's in a pre-contemplative state, so we actually on every single patient do their stages of change, because if I've got great recommendations, but I give her to at the wrong time, I've also failed the system. So we have to figure out when they're ready to move forward, then give them the information. If they're not ready to move forward, we have to move them forward. So that's what you're speaking to, is that her system is telling her, don't get off the opioids. Her body is telling her, don't get off the opioids. And we know, and the evidence is there, you got to get off the opioids. Your osteoporosis is only going to get worse as you age. And now we've suppressed your sex hormones, which are part of why the calcium goes down into bone, so that you don't have osteoporosis. So we're setting her up. We're suppressing her immune system as she ages. And we're giving her something that gives her pain. It makes her pain worse instead of better. But she likes it. So that's the addiction part, and that's the management stuff. So we have a really tough hill to climb, and I can't climb it alone. So we have an interprofessional team. And your other questions, we have to have an interspecialty team. I have to work with orthopods and neurosurgeons and neurologists and family doctors to do this. I can't do it alone.
Can I say to her case manager, here's the ECHO program, research it and register, and then she can get the client in some kind of...
It's just for the healthcare professionals. The patients are never at ECHO.
Okay.
It's just for the healthcare professionals.
So our case manager, who
Yeah.
the insurance paying is an RN, so she could help.
Yeah, so it's, the patients that are presented are always anonymous. We don't know the name, we don't know the details, but the healthcare professionals are the ones who present.
Last question. Well, he's been waiting for a while. You're going to have to ask us. You can come and talk to us afterwards.
Question to Dinesh. Have you biopsied or are you planning to biopsy the blobs?
Repeat the question so it's loud.
Yeah, so Dr. Leekman asked if I'm proposing to biopsy the blobs, and actually you're absolutely right. I am proposing to biopsy blobs. Yes.
So can I, a very quick one, to anybody, it seems that the piriformis diagnosis is trendy these days. What's your position on it, anybody?
You want to handle that one, Dinesh?
Sure. Yes, thank you for the question. That's a very interesting diagnosis to make. There's criteria for that as well. It's a difficult one to make. I'm proposing using ultrasound to make that diagnosis along the lines of what I showed you, but localizing the muscle and so forth. And there's some special tests that we do clinically that would help us to diagnose that as well. So, but the real thing is to make sure that you don't have the other things that could present like it, like the nerve pinching in your back going down your leg and so forth. So.
So, excuse me, a lot of people have more questions, and there may be an opportunity to do a follow-on session. You know, I wanted to thank my colleagues, John, Andrea, Dinesh, and many others that are in the room today. These sessions are always well attended, and they create more questions than we can answer within an hour and a half. So we will put on, I think, a follow-on session. Like I said, I think our colleagues will stay here for a little bit in case there are some additional questions coming from the audience. Yes, Arlene? And I just thank you, Arlene. So again, this will appear online, and we'll make sure you get the link. I wanted to mention that today is a very special day. It's called Giving Tuesday. Has anyone heard of Giving Tuesday? It's been ongoing for a number of years now. It's a Canada-wide initiative, and it encourages people to consider supporting charities and organizations that make a difference in our community. It's not just about the dollars, it's about volunteering your time as well. So again, Giving Tuesday is today. I'm going to make a pitch. I'm going to make a public pitch right now. There were a lot of questions, there were a lot of interest from all of you. So I'm making a pitch to all of you. It's the end of the year. It's November, end of November, almost December. Most people think about their charitable giving during the holiday season, which is right around the corner. What I would suggest to you, if you have not yet exhausted your charitable spend, your charitable donations for this year, consider Toronto Rehab, and more specifically, consider our group here in musculoskeletal and pain, Andrea, Dinesh, and John, and research in general. As I think, did you say, John, the Ministry of Health does not fund research within health science centers, which we are. It funds clinical care. But the reality is it's the combination of research and clinical care working together that makes great things happen, right? So again, it's Giving Tuesday. We had Jim Vigman speak and ask a number of questions. Jim puts his money where his mouth is. He's a massive supporter of Toronto Rehab. Thank you for that, as are many other people in this room. Again, Giving Tuesday, consider Toronto Rehab. It is an extraordinary place, and we are making a difference. As I said earlier, we are doing some tours of our research facilities. If you have not seen them, go check it out. It is super cool. The amazing research that's taking place here at Toronto Rehab, #1 facility in the world. On that note, I wish you a very wonderful day. Thank you again for coming here today. Thank you, Bob, for sponsoring our series. And we'll see you soon.